Hello, friends. A letter worth up to $2. $400 is about to hit your mailbox. And if you're retired, September is the month 3 real changes start touching your Social Security and Medicare. Stay with me until number 3, because that's the one most people have completely backwards. And getting it wrong is costing seniors real money right now. Number 1. The most important piece of Medicare mail of the entire year must reach you by September 30th, and most retirees throw it away. It's called the Annual Notice of Change, the ANOC. Federal rules require your Medicare Advantage or Part D drug plan to get this letter to you by September 30th, 2026, and it lists every single thing your plan is changing on January 1st, 2027. Your monthly premium, your deductible, your copays, which drugs are covered and at what tier, and which doctors and hospitals are still in your network. Here's why this year's letter matters more than usual. Insurers are trimming Medicare Advantage benefits for 2027, cutting dental, vision, and over-the-counter allowances. And some are pulling out of entire counties, which means your plan may simply not exist next year. There is one piece of good news buried in the fine print. The out-of-pocket cap on covered prescription drugs rises to about $2, $400 for 2027, up from $100 this year. Once you hit that number, your covered medications cost you nothing more for the rest of the year. But everything else can move against you. Say your plan is a zero premium Advantage plan today. The ANOC might show a new $45 monthly premium, a drug deductible jumping from $150 to $615, and your cardiologist quietly dropped from the network. If you never open the envelope, you find all of that out in January, at the pharmacy counter, or in the waiting room. And by then, the switching window has closed and you're locked in for the year. That mistake costs some households well over $1,000. The letter looks like junk mail. It arrives in the same envelope style as every other piece of insurance marketing, often bundled with a thick evidence of coverage booklet, and that's exactly why it gets tossed. So here's your move. When it arrives this September, open it and check 5 numbers: the premium, the deductible, the copay tier for each medication you actually take, whether your doctors are still listed in the network, and the plan's maximum out-of-pocket. Write those 5 numbers next to this year's numbers. If anything moved against you, you have from October 15th to December 7th, Medicare's Annual Enrollment Period, to compare plans and switch, with the new coverage starting January 1st. And there's one trap inside this trap that catches thousands of retirees every year. If the letter says your plan is leaving your county or shutting down entirely, doing nothing is the worst possible response. When a plan terminates and you take no action, you're dropped back into original Medicare, often with no drug coverage at all. And going without drug coverage for more than 63 days triggers a late enrollment penalty that gets added to your Part D premium for the rest of your life. The system does give you extra time in that situation, a special enrollment period to pick a new plan, but only if you actually use it. And you don't have to decode any of it alone. Every state runs a state health insurance assistance program SHIP, with trained counselors who will sit down with your ANOC and your medication list and compare plans for free, with no commission and nothing to sell you. Call 1-800-MEDICARE or check shiphelp.org to find yours and book the appointment in early October, before the enrollment rush fills their calendars. 15 minutes with that letter in September protects you for all of 2027. Number 2. Your 2027 raise is being decided right now, and September is the final month of data. The Social Security Cost of Living Adjustment isn't a political decision. It's a formula. It compares average inflation in July, August, and September of this year against the same 3 months last year, which means the September inflation report is the last number that goes into the calculation before the official announcement in mid-October. Based on the data so far, the Senior Citizens League is projecting a 3.8% COLA for 2027, noticeably bigger than the 2.8% raise you got this January. On the average benefit, 3.8% works out to roughly $73 more per month, or close to $880 over the year. On a $2,000 monthly check, it's about $76 a month. But before you spend that raise, remember what happens to it. Medicare Part B premiums are deducted straight out of your Social Security check before the money ever reaches your bank. This year, the Part B premium jumped $17.90, from $185 to $202.90 a month. and it swallowed roughly a third of the average COLA. If 2027 brings another increase in that range, your $76 raise quietly becomes something closer to $55 in actual spendable money. Now here's the mistake that spreads every single autumn. Headlines and social media posts promising a COLA bonus check or telling seniors they must sign up, register, or verify their information to receive the increase. That is false every year. The COLA is automatic. Every beneficiary gets it. Nobody from Social Security will ever call, text, or email asking you to claim it. Anyone who does is a scammer trying to walk away with your Social Security number or your bank login. One more note of caution before you count that money. 3.8% is a projection, not a promise. Analysts have already warned it could land lower if inflation cools in the September report, so the smart move is to build your 2027 budget on a 3% raise and treat anything above that as a cushion. The official number comes in mid-October, when the Bureau of Labor Statistics releases the September inflation data and Social Security announces the final figure the same week. From a government press release, not from a YouTube thumbnail or a Facebook post dated before mid-October. Your real action step is simpler. Go to ssa.gov and make sure you can log into your My Social Security account this month. That account is where your official COLA notice appears in the message center in late November or December. It's where you confirm the exact dollar amount of your new 2027 check, and it's where you verify your direct deposit information is correct, before notice season, not after something goes wrong. And keep watching, because number 3 is that new September rule being shared in retirement groups and comment sections right now. And the truth about it is the opposite of what you've been told. Number 3. The change everyone is warning you about does not exist, and believing it does is exactly how retirees get robbed. Let me be direct. There is no new Social Security rule taking effect in September 2026. No new penalty, no benefit suspension, no verification deadline. We checked the Social Security Administration's own regulatory announcements. Nothing takes effect this month. So what are those viral posts actually mixing up? 3 real rules from other dates. First, paper checks. Social Security stopped mailing paper checks back on September 30th, 2025. That deadline came and went a year ago, and if you're receiving your benefit today, you're already on direct deposit or a direct express card. Second, overpayments. It is true that Social Security can now withhold up to 50% of a monthly retirement or disability check to claw back money it overpaid you. But that policy is already in force. It didn't start this September, and if it ever hits you, you are not helpless. You have the right to file an appeal on Form SSA-561 if you believe the overpayment amount is wrong, or request a waiver on Form SSA-632 if the mistake was Social Security's fault and paying it back would cause hardship. And filing within 30 days of the notice generally stops the money from coming out of your check while your case is reviewed. Retirees who don't know those form numbers simply watch half their check disappear. Retirees who file them keep their full payment while they fight it. Third, the big 2026 changes. The 2.8% COLA, full retirement age settling at 67 for everyone born in 1960 or later, and the repeal of the rules that used to slash benefits for retired teachers, police officers, and firefighters with public pensions. All of those took effect in January, not September. Here's why this matters for your wallet. Scammers ride these fake headlines. The week a new September rule post goes viral, the phone calls start. Someone claiming to be from Social Security, warning that your benefits will be suspended under the new rule unless you verify your number or move your money to a safe account. Understand this clearly. Social Security will never call to threaten suspension, never demand payment by gift card, wire transfer, or cryptocurrency, and never ask you to move money anywhere. The moment you hear any of that, hang up and dial the real number yourself, 1-800-772-1213, and use the two-source rule for every scary headline. If a new rule doesn't appear on SSA.gov or Medicare.gov, it is not real, no matter how many times it's been shared. One more piece of certainty for this month. Your September payments arrive on the normal schedule, SSI on September 1st, and retirement benefits on September 9th, 16, or 23, depending on your birth date. No gaps, no delays, and no secret bonus check. Anyone promising one is setting up a theft. So here's the real picture. The changes that matter this September are the quiet ones. A letter in your mailbox deciding what you'll pay for healthcare in 2027, and an inflation report deciding the size of your raise, not the loud fake ones in your newsfeed. Your one action step this week: log in to your My Social Security account at ssa.gov, confirm your direct deposit details, and put a note on the fridge to open that ANOC letter the day it arrives. If this cleared things up, subscribe for weekly updates, and share this with a friend or family member before a fake headline reaches them first.